order, everyone. All right, who wants to start?
Prime Minister, there's still several flights from India due in before the Sunday deadline. What special arrangements, if any, will be made for the passengers coming on?
And look, for those flights that will continue to come in before the new suspension comes in place, they'll have the same level of precaution and care as we do for every flight. Keeping in mind, we treat every international arrival as if they potentially have COVID-19. That's always been our practice, and that doesn't change.
Will you look at moving those passengers into a specific facility and keeping all passengers from high risk in one hotel?
As I say, we treat everyone as if they may have COVID. Everyone is screened, and so if someone is thought on arrival to potentially have COVID, they may be screened to go into our quarantine facility straight away. We then undertake our day zero testing that provides confirmation of whether anyone further needs to go into quarantine, but we already have mechanisms we're confident in to deal with anyone coming in from either low or high risk countries appropriately.
What percentage of passengers on those flights from India are testing positive? We've had raw numbers, but do you know what percentage?
I would need to get an updated figure for you. What I do know is over the last 2 weeks we've had over 60 passengers who have come in from India who have tested positive for COVID-19. My recollection is that we have roughly 90 active cases at the moment, so as a proportion you can see it is relatively high. If that number of people from any country were coming in with COVID, that would give us cause to pause and look at mitigations to try and reduce that risk. So this is not country specific, it is about the cases we are seeing currently from that region.
Have you missed legal advice about stretching that 2 weeks out?
I haven't received any to date, but we're confident, of course, in what we've done now.
Have you misled New Zealanders by saying that they're always welcome home?
Oh, absolutely not. Our goal and our approach through all of this has been to bring home Kiwis from abroad, and over 130,000 of them have. We have a higher number of people coming back to New Zealand than, for instance, per capita, the likes of Australia. We've worked very hard to make sure we can do that, but I want people to be safe in their journey. At the moment, I cannot guarantee travellers at the moment coming from India are safe from being infected with COVID, and I want to improve that.
What reassurance can you give to those Kiwis who are stranded in India that this will lift after 2 weeks?
This is a temporary suspension. We're very clear on that. We wanted this pause to allow us the chance to see if we can improve the risk that is being presented both to the travellers but also within our system. But it is temporary.
What specific advice did the Ministry provide to Cabinet that led you to make the decision to suspend arrivals?
So we've been discussing this issue and our concerns over high-risk travellers for some time. We received some advice on Monday that did not present to us options on how to resolve the issue, discuss some of the potential things at play. We went back and asked for more work to be done. My view was in the meantime we needed to put a hold on travel.
Given you'd have all those MIQ bookings in the system, you've seen what's happened over the last 30 days in terms of the cases testing positive. Did you have projections around how many arrivals could test positive? Did you have concerns about the capacity in Japan?
No, really, no. To the best of my knowledge, we haven't. Certainly I hadn't received those. For us, it was the fact that, we had put in place day zero testing as a way to bring down some of the numbers we were seeing coming through from high-risk countries. We did see an impact from that. We did see our daily, our rolling average fall away. We have since then, of course, seen sustained numbers coming through, particularly from India, and it gave us cause for concern as to why our day zero testing wasn't having that same, our pre-departure testing wasn't having that same impact. And so this gives us the opportunity to look at other options to try and enhance our program and reduce risk.
Prime Minister, is the Ministry of Foreign Affairs undermining you by exporting weapons to countries that you've been consistently raising human rights concerns about?
Yeah, I want a little more information if I may. This issue's just been raised. I'd be happy to provide you with as much information as I can, but without a bit more specificity on the background of your question. Unfortunately, I can't provide that to you on the spot.
Can't help you on that either.
Yeah, sorry. Do come back
government-
to me though, do come back to me.
The government doesn't have an accurate picture of whether all border workers are actually being tested as per your testing order. Is that a problem?
Oh, of course, we are very reassured of our testing regime across those agencies for which we have that responsibility, but the orders make it very explicit. If you are an employer, for instance, a private enterprise, and your workforce is covered by a testing order, you have responsibility to make sure they are being tested, and the orders are very explicit on that. And there is a penalty regime for employers who are not doing that.
Only around 11,000 border workers actually use the government's testing register, so you're in the dark for thousands of others.
Again, what I would contest here is we've always been explicit for those border workers for which we have responsibility, those who are at our airports working for the likes of customs, immigrations, MPI. We have absolute responsibility for those testing regimes. Some individuals, however, are working for private employers. The responsibility sits with that employer to make sure that that workforce is being tested, and there are penalties if they do not.
What's your message there?
Of course, the obligation by law is that employers make sure that their workforce are being tested.
Prime Minister, models are suggesting the situation in India is going to get far worse before it gets any better. So what confidence can you have that this is a 2-week state of proceedings?
For us, it is about exploring additional options, making sure that that pre-departure testing is robust as it can be, that it's meeting the same level of expectation and quality assurance that we would have, for instance, in the New Zealand system. Looking if there are things that can be done around that pre-departure or on arrival to reduce risk. So we're exploring a number of options in the 2 weeks we have available.
You've said that you have confidence in the legitimacy of the test results, that they're not
So
fraudulent.
that is the advice Health have provided to date.
Right. So when you say you're exploring the testing regime, what is the problem?
So just to give an example, one of the questions we have is that our PCR testing in New Zealand, we run a test, and I'll have someone who's got more expertise in explaining this. We will run a test a number of times in order for us to pick up if someone is either right at the end of infection or very early on in infection. What we're not clear on is whether or not every country that's providing pre-departure testing is running their PCR tests in precisely the same way. That gives us that early indication of some early onset of infection.
Do you have someone on the ground who's doing quality control for you?
So one of the things that we're exploring is just the issue of quality assurance around testing regimes.
So might you appoint some New Zealand officials or contract someone?
I don't want to get too far ahead of ourselves on the final outcome, but one of the things we are exploring is the quality assurance around testing.
Do you need isolation facilities that you have some kind of command over at that end of
Yeah, and look, that has been put to me as a potential option. It is fair to say we're exploring a range of possibilities, but given our experience here in New Zealand around how difficult infection control in facilities are, particularly when you have a large outbreak in the community, not just within facility, I don't think we underestimate the challenge that would exist with that. If I may, I better just canvass around.
4-year-old MIQ worker who was tested positive and wasn't vaccinated. He didn't show up to 2 vaccination appointments. Is he an anti-vaxxer?
Look, as far as I understand, you will have already heard from officials from the Ministry of Health that was not the issue at play. So yes, there were 2 appointments, but there were some issues with the attendance of the individual in question. But certainly we're told that this does not seem to be an issue of vaccine hesitancy. For me, I think it's more important that I leave the health, those on the ground who are working directly with the individuals involved to explain those issues rather than me interpret them.
Australia's vaccine rollout is going to slow right down now. Any concerns there with our upcoming bubble arrangements?
No. The trans-tasman arrangements were not contingent and are not contingent on a vaccine program. And that's because for both countries, we've been running essentially elimination strategies where we stamp out COVID whenever or wherever it may emerge. So it's never been contingent on vaccine.
One from New Zealand doctor.
Yeah, I'll just conclude if I can. Thank you.
So just a simple one. When will the government be announcing the health reform decisions of the cabinet?
In due course. Look, by the end of the month, yes, I've given that statement, and it will still be by the end of the month.
Yeah. Great. Thank you, everyone. Okay. No, I'll be leaving that to Dr. Bloomfield and Minister Hipkins. That's not something I've been advised of at this point. However, I have early indications were that we're not always able to genome sequence depending on the test result that we're working with. So, but I'll leave that with them. And
Australia's stopping
last one.
AstraZeneca for under 50s. What does that mean here?
Well, essentially, we are still in the process of having AstraZeneca go through our own independent approval process. So AstraZeneca as yet has not been approved for use in New Zealand. Our team, our professionals, our independent professionals are still assessing AstraZeneca as a vaccine for New Zealand. I think the most important point for me to make here is currently there is only one vaccine that has been approved by MedSafe, and it is the biotech Pfizer vaccine. Okay, I'm going to call time. Thank you, everyone.
Thank you.
The answer to that was yes, there is enough Pfizer for everyone over 16.